Good day, everyone. I'm Pooja Joshi, your host for today's episode. In this session, we focus on a condition that is common yet often misunderstood: irritable bowel syndrome, or IBS. To help us navigate this important topic, we are joined by Dr. Balaji ji, DM at KIMS Hospital, Bengaluru, a respected expert in functional gastrointestinal disorders. Today, Doctor will walk us through early symptom recognition, simplified diagnostic approaches, and effective evidence-based management strategies for IBS in routine clinical practice. Doctor, thank you for being with us.
Hi, I'm Dr. Balaji G, medical gastroenterologist, working at Krishna Institute of Medical Science, Electronic City, as its senior consultant.
So, doctor, question for you is, once IBS is diagnosed, what is your first-line approach to management?
Yes, once diagnosis of IBS is made, the first and most important thing is talking and counseling the patient about the disease itself, which is most important, because people think IBS is deadly disease, where they think it cannot be cured, and it's going to take their life away, which is definitely not so. It is a benign disease. So we need to spend more time with the patients, talking, explaining do's and don'ts, relieve their stress, anxiety level, which is most important in treating patients with IBS. So my first approach will be always talking, so that the anxiety level and stress level will be relieved by explaining the disease as such. And then I'll go for other line of management on the next sessions.
How do you tailor treatment between IBS-D, IBS-C, and mixed IBS?
Okay. See, IBS is a spectrum of disease. It's not just one disease and we give one treatment. It's a mixture of patient's symptoms. When patients come with IBS, each and every patient is unique, because some people will respond to some drug, some people will not respond to the same drug. So this tailored approach is very important in all patients with IBS, irrespective of whether they have more diarrhea or more constipation, or some people they have mixed. So with respect to pharmacology, especially these medications, they're always very tailored approach is the best way of treating patients with IBS, rather than prescribing the same medication for all patients.
What's your opinion on the role of rifaximin in IBS-D? Where does it fit best?
Rifaximin has got a good role in the patients who has got IBS diarrhea predominant, because this is a one drug which helps in the relieving these symptoms and also improves the quality of life. But the concern is patients should not keep taking this drug for for months together. We give as a cyclical treatment or rescue kind of treatment in a patient with IBS diarrhea. So this rifaximin is a very good drug in controlling patients with diarrhea.
How do you decide when to repeat a course of rifaximin or switch to another therapy?
Oh yes, this is a good and important question. Repeating rifaximin is definitely needed in two scenarios. One, when the patient has recurrent symptoms after taking 4 weeks of rifaximin, if the symptoms comes back again, we give again this second session after 6 to 8 weeks of gap. And other set of there are refractory patients, in the sense patients with again diarrhea predominant, not constipation, diarrhea predominant, where they're not responding to any kind of management. Then upfront we decide, or I decide, in giving 2 to 3 cycles of rifaximin with a gap of 6 to 8 weeks in between. So these two are important in order to give rifaximin in a patients with a recurring or refractory IBS patients.
How important is patient counseling in IBS management? What key messages do you give?
Yes, as I told you in my first question, whenever we diagnose IBS, the most important line of management will be talking and counseling, explaining about the patient do's and don'ts in IBS patients. Okay, because patients will be in a lot of like stress or anxiety or like phobia, which they get like wrong information from like certain like social medias or from neighbors or like friends or colleagues and all. So what I tell them, like it's like the first thing is like sleep. They should have at least adequate 7 to 8 hours of good sleep. Next is like diet, a well balanced good diet which contains at least certain amount of fruits and veggies and proteins in their diet. And the patients who have got like chronic or long-standing symptoms, I ask them to follow low FODMAP diet at least for like 6 months. And the most important is like no googling and no checking in Chat GPT about the disease, their complications, or the managements and all. That will definitely add on to the it's like stress levels and the anxiety level. So definitely any information if you want, you can like ask us rather than like checking in the Google or Chat GPT or like Gemini. And the fourth thing is like, over the counter drugs should be avoided. Any symptoms, any issue, please stop taking medication from the over the counter because certain medications will trigger IBS like symptoms. So these four things should always keep in mind. I mean, I give them patient one is good sleep and right amount of like diet, no over the counter drugs, and stop checking the details of the disease of like, about like IBS in Google or internet. This is very important in all the patients.
What's the role of diet? Do you recommend low FODMAP, fiber modification, or any particular dietary pattern?
Yes, I do recommend like low FODMAP to the patients of like IBS, but not all patients. As I told you, only patients with like recurring symptoms or refractory symptoms. In the sense, patients with are not responding to most of the like diet. I mean, most of the medications, and these patients I put them on like low FODMAP diet for at least like 4 to like 6 months, especially with the patients with like IBS diarrhea and like stomach pain and bloating. When these symptoms are there, these are the patients who respond very well to the low FODMAP diet. But thing is, they should like stick to this low FODMAP diet at least for 3 to like 6 months to have a good response.
Do probiotics or prebiotics have a role in IBS treatment?
Certainly, yes. As a disease like IBS, like there is like some amount of like disturbance in the good bacteria and bad bacteria in the intestine, and certain like subset of patient, especially predominantly diarrhea predominant patient or bloating predominant patients, they do respond with probiotics. And yes, in my practice, when the patients come with like IBS diarrhea, the bloating predominant, I do prescribe like probiotics for patients, but only for certain like period of time, not like forever. And yes, they do have a role, which has been like confirmed by like various trials and the various like studies.
How do you deal with recurrent or relapsing IBS cases that come back after initial improvement?
Yeah. As I told you in my previous questions, this recurrence, relapsing is very common in IBS patient. That patient should be like explained, and they should understand that, because IBS is not like a disease where you take like 1 month of treatment and the disease will be completely gone. It's not like that, because there are so many triggering factors. It can be sleep disturbances, it can be from the diet, or it can be from medications or certain infections that medication taking for infections might trigger it. So that's why relapsing recurrence is so common in IBS patients. And whenever the symptoms are recur, it can be constipation or it can be bloating or it can be diarrhea. So based on this symptom,
How do you balance pharmacologic and non-pharmacologic management approaches in IBS?
this is very like important question. So IBS patient, definitely there should be like balance between both pharmacological and non-pharmacological. And non-pharmacological should be like the first line of like management. As I told you, non-pharmacological includes your lifestyle and diet change, which is most important. You have to follow that like strictly. And the second thing is the pharmacological thing is like medications. So definitely when you want to get relieved, or when the patient should be like when we want to make patient happy, there should be like combination of both like pharmacological and non-pharmacological whenever they come and visit us. Again, like counseling the patients, explaining about the disease and telling what to eat, what not to eat. They should always go hand in hand whenever they come and like visit your clinic and we visit you, visit you along with this little pharmacological. So there should be always a balance between both pharmacological and non-pharmacological whenever they visit.
The most common mistake you see in IBS management?
Most common mistake, I see in my patients is their diet and their sleep. Most of them are sleep deprived because of looking at the reels, is- spending more time on the screen. And next thing is the diet because processed foods are the one which trigger IBS. And second thing skipping their breakfast or not eating the right amount of breakfast or the food what they were consuming from childhood. They have to stick to their that kind of diet. That at least helps to avoid triggering events. So not to try new foods or new fruits or new vegetables whenever you have IBS. So stick to your homegrown food, eat your food in the right time, and avoid eating processed foods. So the most common mistake which is their diet and sleep. Okay, so with this, I thank you everyone for listening to my small talk on IBS.
Thank you, Doctor, for sharing such valuable insights on IBS. Your clarity and practical guidance will certainly help both physicians and patients approach this condition with more confidence. To our listeners, thank you for joining us. Stay tuned for more expert-led conversations. Until then, take care and prioritize your gut health.